Coronavirus concerns gripping Connecticut. Right now on Face the State, more than 200 people self-quarantined, others being tested. Stores running out of sanitizers and masks. What's next? We'll talk with the Commissioner of Public Health, Renee Coleman-Mitchell. Also here, Dr. James Mazo, an infectious diseases specialist. And Lieutenant Governor Susan Bysiewicz is here with an update on how she and Governor Lamont are handling the coronavirus crisis. And she also has new information on how women will transform corporate Connecticut on this International Women's Day. Plus, legalizing marijuana. We'll hear from both sides. It's all straight ahead this Sunday, March 8th, 2020.
From Eyewitness News, Connecticut's most watched local political program, this is Face the State.
Good morning. We begin with coronavirus and how it's impacting Connecticut. With us now, the Commissioner of the Department of Public Health, Renee Coleman-Mitchell, also the Head of Infectious Diseases at St. Francis Hospital, Dr. James Mazo. We thank you both for being here with us in the program. Now, we should point out that we are taping this on a Friday. So where does it stand right now in terms of, we still don't have any confirmed cases in our state,
That is
correct?
absolutely correct. We have our state public health lab doing all the testing thus far, and there are no positive cases for what's called COVID-19. That is the new name as opposed to coronavirus. So there's no
COVID-19 is what we should be calling it.
COVID-19, that's what it should be termed. We also have tested 12 individuals. Those test results were negative, and we have 11 currently in the queue. So we are waiting to hear from those 11 results.
And we have 200 of them who've been self-quarantined, correct? What led to that?
Well, that's a separate piece. So the 200 are people who have come into the U.S. as travelers, and they were self-monitored. We don't use the term self-quarantine, we use the term self-monitoring. But it was really 154 for those individuals. And now we're about down to a couple of dozen or so that are self-monitoring that have traveled into the U.S. from other countries.
Dr. Mazo, what's the difference between having the flu and having COVID-19?
COVID-19 is much more serious than the regular flu. It tends to attack the upper respiratory tract, a little bit different symptoms than the flu. Do start with high fever, but then rapidly goes to the chest, whereas the flu tends to be much more the nasal passages.
So if you're home, you could have the similar symptoms, right?
Very similar symptoms, right. And the majority of people, if they do come down with COVID-19, 80%, 85% are going to do just fine. And you're going to have symptoms that are very similar to everyday common flu.
How does the state find out who has it? The hospital is required to report to your department?
Yes, that's absolutely true. We actually have them report to us. We have been, since the first case has been reported nationally, we have set up a system at the Department of Public Health working with our sister agency, Department of Emergency Services and Homeland Security, in regards to communication, and then we've broken it down to different sectors: healthcare sector, business sector, school sector. So we have been communicating with our healthcare sector and their lead agency of person for infectious disease, epidemiologists, to get this information reported to us as we continue to report and communicate with them on a weekly basis, sometimes 2 or 3 times a week.
Doctor, walk us through what happens if someone comes to St. Francis, goes to the ER and says, I don't feel well, I think I might have coronavirus. What happens?
Right, that's going to be a big concern for a lot of people. First things what we want to do at Trinity Health in New England with our 5 regional hospitals, we're going to be doing telephonic interviews. We're going to ask that, especially if patients feel ill and feel that they need to come to the hospital, to call ahead of time. Or if you're going to be going to your primary care physician, call ahead of time so that this can be kind of handled over the phone. A lot of these cases, like I said, everyone's going to be fine. You're going to have kind of flu-like symptoms. If the symptoms worsen, the fever gets worse, you have difficulty breathing, those are indications where you would need to go to the hospital. At the hospital, we're especially prepared at a level 1 trauma center like at St. Francis as part of Trinity Health New England, that we are going to be able to mask those patients, identify those patients early. We have a large bank of negative pressure and isolation rooms that we'll be able to take advantage of to protect the other portion of the population who aren't sick.
But the only testing is done by the state, correct? And how is that done?
As of today. And then we did get some news just yesterday. Again, this situation right now is extremely fluid and dynamic. It's changing by the hour. So we have been informed that Quest Diagnostics is now able to do some testing as of Monday. We have also been in touch with varying hospital systems like Trinity, Hartford Healthcare, Yale New Haven Hospital, to look at options about having additional testing available as well. And these healthcare systems have said they're looking into it and working with us to have those opportunities available for people to get tested.
How long does the test take to get a result?
The average that we're experiencing at our state lab is five hours or so. You will get a result, the maximum within 24 hours turnaround, but as little as 5 hours.
Doctor, if a patient came to you and said, you know what, I have a trip overseas to Europe. Should I go? What would you tell them?
Well, at this point, we are recommending CDC recommendations. You're going to go ahead and avoid some of those countries that have already been on a level 3 travel warning from the CDC. If you're going to be going to a country that has not been identified, then travel should be safe.
If you're on a plane and someone has coronavirus, came back from a country that has it, you just don't know that, is it possible that it could be airborne and you could get it just by being on the same plane with someone?
Sure, that is a possibility, right? You need to try to protect yourself the best you can, and kind of walks into talking about masks right now. So masks are not something that we really are encouraging people to wear. A lot of times, if you become sick and ill, we want you to mask up, but people wearing N95s, purchasing N95 masks, surgical masks over the counter, and wearing these when you're well is not protecting you. It actually, an ill-fitting N95 mask may harm you. You may be trapping some of that in your mask.
You know, Commissioner, what do we know about the people who were quarantined and are being tested? Were they in these countries where it is prevalent?
Those that have come from those countries that have been self-monitored, is that your?
Yes.
Yes. Those individuals have not been found positive for any coronavirus at this time.
What do you recommend in terms of just protecting yourself, average Connecticut people who aren't going to come into contact with some of these sick people?
There's a lot of good things that we can do. Everyday measures, hand hygiene and respiratory etiquette, cover your cough, cover your sneeze, good hand washing hygiene, back of the hands too, and that would be 20 seconds. So you would kind of sing the alphabet, and that would be enough time to say, okay, I've thoroughly washed my hands. Alcohol sanitizers. We're running low on some supplies locally. Those will be replenished. There are some homemade remedies for making hand sanitizers. That alcohol content is not high enough. I'd refrain from finding these things that you can see on the internet and doing so. Avoid touching your face, touching your nose and your eyes. If you do so, wash up again. And if you use tissues, blow your nose, again, wash your hand.
And it's difficult to predict, but where do you see this going? Do you think we eventually will have cases?
I'm certain that we will. We are surrounded by it right now with our neighboring states, and so it's more than likely that we will. But one of the things I really want to message out there as a commissioner is to say that, for the risk here in the U.S., it's extremely low. The risk is extremely low. And so I really want to make sure people understand that. But we need to take some precautions, as was just currently stated, but also we need to kind of look at how we continue to message it to people, because we don't want to panic. We don't want people to take the wrong actions because of fear.
We've received some word that perhaps younger people aren't being tested, that they're not included in this risk group, like children or teenagers or young adults. If someone fears that they have it, should they be tested regardless of their age?
Well, I would say that if they're experiencing symptoms, they should contact their healthcare provider. And if they're not, what we've done is actually, as of today, as a state, we've put in place a hotline, 211, to answer general questions for those individuals who are not experiencing symptoms. But we've also prioritized who we would suggest in terms of testing. And those would be the very, very young, those are immunocompromised systems, those who are, the elderly or so. And so those are the individuals right now that we've prioritized, and we are looking at how we can continue to get more supplies into our state. Our governor has written a letter asking the federal government to assist in getting more supplies in, kits in, for us to do testing along with the other commercial entities.
Let's say someone came into St. Francis either to see a doctor or go to the hospital, and they feared that they have it, and a test was done. 5 days later, you get 5 hours later, you get the results that this person does have coronavirus. What happens to the scene where he or she was, like the office that he or she was in at St. Francis? Does that get disinfected? Are people quarantined there?
Sure. Well, we already are prepared for this. We prepare for these kind of emergencies year-round. So in the doctor's office, if you were there first, or if you were coming from home, that would be disinfected with regular over-the-counter disinfectants that you would normally use. You can make some at home if you were coming from home. You could use a 1/3 cup of bleach in a gallon of water, and that would be more than adequate to clean counter surfaces. And then, how do you prepare your home? What do you do when you're home? Well, we have a lot of things that we can do where we're there. Emergency preparedness, 2 weeks of supply of food and water. If you're on prescription medications, make sure you have enough medications for 2 weeks if you have to self-monitor at home. disinfect surfaces like doorknobs, light switches, countertops, faucets, sinks, toilets, things that we don't do every day. That's what we want to start targeting.
Do you foresee a situation where the state might have a mandatory quarantine? For instance, let's say someone in your office, your assistant, had coronavirus. Would you have to shut down your office and quarantine everyone in there?
We would take the same precautions as what was just stated, but we wouldn't necessarily shut down the office. We would look at what the options would be in regards to making sure that individual is taken care of first and foremost, and then we would talk about who in the office has had social contact with them and also their conditions. Again, I go back to the priorities. If there's no one having an immunocompromised system, then the people should be generally fine.
Thank you so much for being in the program, Dr. James Mazo, Dr. Renee Coleman-Mitchell, Commissioner of Public Health. We thank you so much for being with us today.
Thank you.
In a moment, the Lieutenant Governor will talk coronavirus, and later, the battle over marijuana. Should people in Connecticut be allowed to get high legally? And we invite you to watch past editions of Face the State. In fact, you can find an old interview with Commissioner Coleman-Mitchell there on our YouTube channel or on our app.